Countries in this region continue to battle the adverse effects of the COVID-19 pandemic on all fronts, including mental health.
Mental health is a very important part of our overall health. In fact, the WHO definition of health focuses on not just the absence of illness or disease, but that ability to live well, to be productive, to enjoy a good quality of life, and so on. So that if we don't address mental health, we're really doing the public a disservice in terms of providing health services.
And providing mental health services is important, especially since challenges regarding mental health were exacerbated by the COVID-19 pandemic. In an effort to fight these challenges, the Pan American Health Organization, PAHO, launched a program to strengthen mental and psychosocial response to COVID and other crises in 3 Caribbean countries: Guyana, Suriname, and Trinidad and Tobago.
From the few studies that have been done, we have seen increases in anxiety, in depression, and there was some uptick in suicidal behavior.
COVID has brought a lot of challenges, and we know that stress and anxiety has increased in the period of COVID.
Now, we have seen increases in depression and anxiety.
The pandemic increased fear, depression, and anxiety among the region's population. Debt, joblessness, containment measures, and financial issues acted as extreme stressors that worsened pre-existing mental health conditions and the risk of suicide.
One of the things that we did, what was a real success, was we launched a directory of services, and we did it initially in the form of a website so that anybody on their phone could find out what the services were and where they were located and how to access them.
We had training, basic psychosocial skills. We had a launch of 2 trainings from the PAHO, who we asked the PAHO to translate these trainings for us. So it was psychological first aid and suicide prevention training.
The project in itself aimed to address, for example, any type of mental health issues that would emerge from any sort of, let's say, emergencies. For example, here in Guyana, we would have a lot of flooding. And this is something that during the period of apart from the COVID pandemic, it had a component to address this.
PAHO's program enabled experts in these 3 countries to better serve their communities that needed greater access to mental health and psychosocial services. The project made a significant difference.
With that guidance from PAHO, we were able to set up a mental health and psychosocial support technical working group and begin to provide for services beyond what we could do as a health service alone.
The project was very successful because we had a lot of different aspects to this project. I have already mentioned the panel discussions, the radio program. We also had materials from the PAHO, WHO, that were translated into Dutch. We had a lot of them, and all of them were translated and also placed on the website.
It actually gives us the technical cooperation from PAHO. It gives us the know-how in terms to be proactive instead of reactive when it comes to dealing with mental health issues.